An analysis of the business value of VistA. Every year, businesses waste millions of dollars on failure information technology projects. In many of these cases, the failure should not be blamed on the inability of managers to accurately estimate business value or identify failures early on, but rather the failure should be blamed on the process used to evaluate the project's business value. In this presentation, business value of IT will be assessed using objective data rather than speculation on financial forecasts based on present value of the investment. Rather than establishing correlations between cost, use, and revenues, causality analysis will be used to provide a more accurate measure of business value. VistA is the electronic health system used by the Veterans Health Administration, the largest healthcare provider in the United States. The system was first created in 1968 and links all medical centers, clinics, and nursing homes to near real-time information. VistA has been credited with improving quality, safety, and efficiency. It is open source and free to the public. Our data was obtained directly from the Veterans Health Administration's website. Using fiscal year 2008 budget submission, volume 2, page 471. To measure cost, we used overall IT cost. To measure IT use, we used total unique patients. And to measure revenue, we used total revenues from the Veterans Health Administration. Using information provided us by a professor at George Mason University, we have reached the following results. We used a Microsoft Excel spreadsheet. The following formulas were calculated. The data was then plotted on a scatter plot to determine causality. The scatter plot of IT cost versus IT revenue appears here. Likewise, a scatter plot is drawn to determine associations between IT use, and IT revenue. The two scatter plots, however, do not show which value is the independent variable and which value is the dependent variable. An assumption is made that increased IT use leads to increased revenues. However, perhaps increased revenues are actually driving increased use of the technology. In order to examine this further, a test of causality was done. When causality was tested, the calculated number closest to 0 was negative 0.373. The negative value suggests there is an inverse relationship between the variables. The value suggests that because of the increased investment in IT use has actually decreased, and as a result, revenues have gone down. However, the significance of this value is relatively weak because it is still far from the value of 0. When using data to make decisions, managers need to be well educated in what values are significant and what values are not. A value that is 0.05 or lower is significant. The closer it comes to 0, the more significant it becomes. It was difficult to find data that was appropriate for the analysis and was available for the same 3 consecutive years. We were only confident in the 2006 data. Since fiscal year 2007 had not ended yet, the budget is still in process, and hence values are predictions. Additionally, the 2008 data was taken from a budget allocation document, and its values are also estimated forecasts. The values chosen may not necessarily be the indicators that offer the best information on IT cost, IT use, and revenue. It would have been helpful to have access to the VA database where data is stored so that more appropriate indicators could be chosen. Nevertheless, by conducting a test of causality, managers can have more accurate information and objective data available to them. This can lead to better decision-making about future investment in IT programs and can minimize the risk of total program failure. Conducting this analysis on data from other organizations prior to implementing an IT program can help managers decide whether their organization should invest in similar IT programs. Additionally, conducting an assessment of association and a test of causality regularly can help managers decide whether the program is meeting its intended results, and whether future investment in it is appropriate for the organization.